Hello, this is Ignatius Cole, and today I'm going to be talking about mode of administration of drugs used in ophthalmology, which means how the drugs that are used in eye disease are used, through which route they are used. And so basically there are four routes through which drugs used in eye disease can be used. One is topical or instillation into the conjunctival sac. Another is periocular injection. Another one is intraocular injection. Another one is systemic route. So it is written here: instillation into the conjunctival sac, periocular injection, intraocular injection, systemic administration. We'll be going through each one of them in detail. So instillation into the conjunctival sac. Out of them, the important one is eye drops and ointments. Others are not so much as important, although they are used. Eye drops is most often used route. So if eye drops is used, you first gotta ask the patient to tilt their head back and pull the lower lid to create a gutter, and put only a drop of the drug into the gutter without touching the eye or any part with the tip of the bottle to maintain this asepticness, and then press the inside corner of the nose to obstruct the nasolacrimal duct and prevent any medication from going into the mouth or nose, to prevent systemic absorption. Some here basic facts about eye drops. They are simplest, convenient and most commonly used drugs in ophthalmology. Only one drop is used because 5/6 of the drop actually goes to waste, because the conjunctival capacity is only 1/6 of a drop. And if you have to use two medicines, a 10-minute gap is recommended. And if you wear intraocular lens, the intraocular lens must be removed before the use of the drugs. Other route commonly used but not as commonly used is the eye drop is the eye ointment. You apply the eye ointment to your lower lid and go to sleep, because it's given for drugs that have to be used 2 hourly or such, and so the eye drop will actually be inconvenient to use 2 hourly. So eye ointment is given, the person applies eye ointment and goes to sleep, and the eye ointment acts all day, all night long. And the ocular is actually more like a transdermal patch in that it maintains a steady supply of the drug. It is used in primary open-angle glaucoma. Pilocarpine oxydes are used. Contact lenses dipped in solution of drugs have also been used. Contact lenses dipped in 4% or 1% pilocarpine have been used for acute angle closure glaucoma. Also, soft contact lenses have been used to deliver antibiotics and antiviral drugs in patients with corneal ulcers. The thing about this route is that the drug has to pass through the cornea. The cornea's epithelial layer is lipophilic and crossed readily by nonpolar drugs, wherever its stromal layer is actually hydrophilic and allows only the passage of water-soluble drugs. So this means the cornea is basically less permeable, and only drugs which are less size than 500 molecular weight and have good fat solubility or have good dissociation of electrolytes can actually pass through. Periocular injections are next commonly used, second to topical drugs, and this peribulbar or subtenon injection is the most important one, because it's been used to give medicines as well as anesthesia. Drug is inserted into the subtenon space, which is the space between the sclera and tenon capsules. The tenon capsule is a layer of fascia that envelops the globe from the limbus to the optic nerve. The subconjunctival route is used to achieve a higher concentration of drug. The drug which cannot pass through the cornea due to their large size molecules pass through the sclera, and subconjunctival route is preferred. Antibiotics which do not penetrate the cornea are given via the subconjunctival route. High intraocular concentrations of antibiotics or steroids can be achieved via this route, and is usually used in acute anterior segment infections and inflammation. Peribulbar and retrobulbar injection are most commonly used to give anesthesia, and out of them the peribulbar route is most commonly used nowadays rather than the retrobulbar route, because of its less side effects. Application of anesthesia before surgeries like cataract surgery is achieved via these routes, and usually peribulbar preferred. Their side effects may include chemosis, retrobulbar hemorrhage, penetration of the globe, inadvertent intravascular or intrathecal injection, optic nerve damage. You can see the subconjunctival injection being given here and here. The retrobulbar injection is being given here. The path is shown right here through the muscles, extraocular muscles, and the peribulbar route being shown here, and the needle is outside the muscle cone, meaning it's extraconal. Peribulbar route is extraconal, however retrobulbar route is intraconal. And this shows the advantages of peribulbar block over retrobulbar block and why the peribulbar route is preferred for anesthesia. Now you can see, you can pause the slide to see it. And this is the subtenon route that has been shown here, along with intravitreal route is shown in this diagram. And now this image shows the same. And now we go to intraocular injections. The intracameral injection, this route was given after post-surgery antibiotic prophylaxis, in which the antibiotic was inserted directly into the anterior chamber in cataract patients. However, it is believed now to be harmful, so the FDA has already banned it in USA, and so the intravitreal injection, however, is still in use. In intravitreal injection, the drug is given into the vitreous humor inside the globe of the eye. The intravitreal route is given to flood the ocular tissues with antibiotics in acute endophthalmitis, and vitreous implants have been used to deliver ganciclovir in the treatment of cytomegalovirus retinitis, and fluocinolone has been given via the intravitreal route for chronic uveitis. The systemic route is less often used in ophthalmology. However, inflammations or infections involving the posterior retina, optic nerve or orbit, which cannot be reached by the local application, require systemic therapy. And the systemic therapy is impeded by the fact that some drugs cannot permeate the blood aqueous humor barrier and reach the area of infection in the eye. The ability for drugs in the system to reach the aqueous humor depends upon their lipid solubility. So the basic facts we should learn from today's lesson is that in ocular therapeutics or ophthalmology, the topical route is most commonly used, instillation into the conjunctival sac, and in that also mainly eye drops are used. And for regional anesthesia in ocular surgery, the peribulbar route is most often used commonly. Thank you. This is my first lesson. More to come.